The key results of the FLEX trial presented during this ASCO meeting are severalfold. Most importantly, we now can improve survival by adding cetuximab to a standard chemotherapy. Secondly, the side effects were well tolerated, manageable, and as expected. So we have now a major advance by prolonging survival in a broadly selected patients with advanced non-small cell lung cancer. The improvement in survival seen in the FLEX trial is not only statistically significant, but it's of clinical relevance for the patients, particularly because it's in a broadly selected patient population. We had several secondary endpoints in the FLEX trial. One of the endpoints was response rate, and it was significantly higher in the cetuximab arm compared to the chemo alone arm. Progression-free survival was not significantly prolonged. Reasons for this are most probably that progression-free survival is a very soft endpoint and difficult to assess in a clinical trial. But most importantly, the major endpoint that is relevant for the patient survival has been met. We have clearly demonstrated a survival benefit in the broadly selected patient population with advanced non-small cell lung cancer by adding cetuximab to a platinum-based standard chemotherapy protocol. The major difference to other targeted treatments is that many of these targeted treatments in combination with chemotherapy failed. The only drug that is currently used as a targeted treatment in advanced non-small cell lung cancer is bevacizumab, which added to a chemotherapy also results in a clinical benefit. However, this is more in a selected patient population. In contrast, the FLEX trial demonstrated the benefit, the survival benefit in a much broader patient population. The FLEX trial demonstrated a benefit of cetuximab in combination with cisplatin vinorelbine. In the meantime, data from other trials also indicate that cetuximab will improve the outcome of other chemotherapy protocols, suggesting that the effect of cetuximab will be independent of the type of chemotherapy. For the evaluation of the effect of systemic treatments in advanced non-small cell lung cancer, we have several parameters. By far the most important endpoint is overall survival. There are, of course, other endpoints such as response rates, progression-free survival, quality of life, and of course, safety. But with regard to the efficacy, the overall survival is by far the most important and the most relevant parameter for the patients. The FLEX trial clearly demonstrated a survival benefit by adding cetuximab to a standard chemotherapy protocol. Based on the results of this trial and based on results from other randomized and non-randomized phase 2 trials, I do believe that adding cetuximab to a platinum-based chemotherapy sets a new standard for the treatment of patients with advanced non-small cell lung cancer. The FLEX trial will certainly have a clinical relevance in the sense that the FLEX will change treatment of advanced non-small cell lung cancer in the first-line setting. Patients will now benefit from the addition of cetuximab to a platinum-based standard chemotherapy protocol. And I think that is a major step forward for our patients. The risk factors for lung cancer and, of course, also non-small cell lung cancer are smoking, passive smoking, and active smoking. So more than 85% of all lung cancers are diagnosed in smokers or former smokers. Other risk factors do exist, but they, in comparison to smoking, have much limited significance. Treatment of advanced non-small cell lung cancer patients aims at two important things. First, I want to live as long as possible. So prolongation of survival is an important parameter. The second important parameter is symptom relief of cancer-related symptoms. So survival and symptom relief. Treatment of advanced non-small cell lung cancer has certainly changed over the last 10 years. One of the major advances was the establishment of doublets, platinum-based doublets with third-generation drugs. They are now considered as the standard option for patients with untreated non-small cell lung cancer. Another advance was the establishment of second-line patients. We have now at least 3 drugs that are widely used in management of non-small cell lung cancer in patients who progressed after first-line chemotherapy. And there are other advances in non-small cell lung cancer. One of the most important advances over the last 5 years was the establishment of the postoperative adjuvant chemotherapy. So during the last years, there have been several advances in the management of non-small cell lung cancer. And what we are now seeing in the clinic is the integration of targeted treatments into standard chemotherapy.